Hi, everyone. My name is Teresa Casanovas. I am a hepatologist and now ELPA Scientific Committee Coordinator. On Rare Liver Disease Week, we would like to update you about some rare liver diseases. Today, we will talk about autoimmune hepatitis. It is my pleasure and honor to have Dr. Mar Ribeiro Barciela, a medical doctor specialized in internal medicine focused on liver diseases, particularly viral hepatitis and immune-mediated liver diseases. Dr. Mar Ribeiro is an internist focused on liver diseases and involved in clinical care and research. She works at Hospital Vall d'Hebron in Barcelona, a European reference center for liver diseases and liver transplants. She's an expert on autoimmune hepatitis. Dr. Mar Ribeiro is committed with liver patients. She's involved in multi-center research studies, community education, and prevention efforts. She's authored and co-authored many scientific publications considering autoimmune hepatitis. She works with multidisciplinary teams to investigate viral hepatitis and immune-mediated diseases to improve patients' quality of life. She's a clinician and researcher, and regarding autoimmune hepatitis, an underdiagnosed and a challenging disease, we must consider that it could be well controlled. Today, Dr. Mar Ribeiro will present autoimmune hepatitis, an underdiagnosed liver disease, and its early diagnosis and treatment are crucial. Today, we will share important concepts and recommendations for families and for patients. Thank you, Dr. Mar Ribeiro. The floor is yours.
Thank you very much, Teresa, for your kind introduction and for the invitation for joining me in this webinar. This is my this is my agenda for today. I will start with a very brief definition and prevalence on autoimmune hepatitis. From my point of view, the importance of the disease, the treatment, and last but not least, the patient's quality of life. This is a very brief summary of the first description performed by Waldenström in the 50s. And as you will agree, this picture of the disease remains very valid, very true. This is very typical from women with some extrahepatic manifestations such as arthralgia or endocrine disorders. At the blood test, the typical findings are the increased levels of AST, ALT, transaminase, but also immunoglobulin G and the presence of anti-antibodies and as positive. And also in liver biopsy, the typical findings are the presence of plasma cells, but also interface hepatitis. And this is one of the few diseases, autoimmune disease, liver diseases, in which the performance of a liver biopsy is still needed for diagnosis. Autoimmune hepatitis is a chronic autoimmune disorder of the liver. As I have already mentioned, it's very typical from women. Roughly 3 out of every 4 cases of autoimmune hepatitis are diagnosed in female gender. It has 2 peaks of age for presentation. The first one in young adults, mostly teenagers, but also there is a second peak for presentation among women on her 40-60. It has a very wide range of symptoms, from women that are completely asymptomatic and to in the post side, women that develop acute liver failure with development of jaundice and hepatic encephalopathy. Some other very typical features of autoimmune hepatitis: the presentation at porphyrium after delivery. Women normally has some history of other autoimmune disorders. The most typical are the presence of hypothyroidism, lupus, rheumatoid arthritis, or even type 1 diabetes. And also autoimmune hepatitis have a family association. If you have a relative, like your father or a brother, with autoimmune hepatitis, then you will have a 5-fold risk of developing this disease. Concerning prevalence, of course, this is a rare disease. In Europe, it is estimated there are more or less 20 cases for every 100,000 inhabitants. However, the prevalence of autoimmune hepatitis is increasing. Herein, I am showing you data from the Denmark National Registry for Autoimmune Hepatitis. It is a study performed more or less during a 20-year period of time. The global incidence of new cases of autoimmune hepatitis were 1.7 for every 100,000 inhabited years. However, the incidence of the disease increased twofold during the period of the study. So it is clear that the prevalence of the disease is increasing. From my point of view, which is the real importance of autoimmune hepatitis? One of the most important, one of the most vital critical points of this disease is that there are many patients that are completely asymptomatic. So the diagnosis is performed by the finding of analytical abnormalities, mainly the increased levels of transaminase. And this is important because many patients are diagnosed very late. In fact, out of every 3 adults and 1 out of every 2 children with autoimmune hepatitis already present signs of liver cirrhosis at presentation at the diagnosis of the disease. So we have to stress, we have to work in order to achieve an early diagnosis to try to change the prognosis of the disease. It is also important that also presentation acute hepatitis can present as an acute hepatitis hepatitis. And this is very important because we have a risk of developing acute liver failure with the need of liver transplantation or even acute or chronic liver failures in those patients who have an underlying liver cirrhosis. Which is the prognosis of patients with autoimmune hepatitis? Which are the more typical complications during follow-up? Autoimmune hepatitis have a 10-year cumulative risk of developing hepatocellular carcinoma. It's relatively low in contrast with other liver diseases. It is 0.7%. And in autoimmune hepatitis, the risk of developing hepatocellular carcinoma is exclusive of patients with liver cirrhosis. The 10-year mortality rate is a bit higher than general population, more or less 26% mortality rate. And this is mainly because of the mortality risk during the first year after diagnosis. Later, the risk is also higher than general population, but it decreases. Happily, we have treatment. The goal of therapy in autoimmune hepatitis is the achievement of complete biochemical response. And this is defined as normal transaminase levels, but also normal immunoglobulin levels. For achieving this goal, we have a therapy of choice that is based on the use of azathioprine plus minus steroids. Happily, azathioprine can achieve complete biochemical response in a high percentage of patients, more or less 90% of patients with this therapy can achieve complete biochemical response, and it has a very favorable side effects profiles. However, some patients also need the addition of steroids, corticosteroids, in order to achieve complete response in addition to azathioprine. However, in some patients, the doses of azathioprine has gastrointestinal side events, and this is the main cause for discontinuation of the therapy. If we have any problem with azathioprine, there is life beyond azathioprine. Of course, there is. The first step in those patients who lack to achieve a response with azathioprine, the first step will be to the adjustment of the doses. We can increase. We have now the possibility to measure the metabolites of active metabolites of azathioprine, and this is very useful first to address compliance of patient to therapy, but also to adjust the dose of azathioprine. If there is an intolerance, mainly when we increase the dose of azathioprine, the patients can develop a gastrointestinal intolerance treatment. So we have an alternative, a very useful alternative, that is mycophenolate. This is important. This is mainly useful in those patients who have intolerance but have already achieved a complete response with azathioprine. And there is more or less a 10% of patients who fail to achieve a response with just acetoprin, even when we add steroids. And in this case, if the response is insufficient, we have to move to third lines of therapy. We have tacrolimus, we have cyclosporine, and even we can use monoclonal antibodies such as infliximab. We have mainly information from children with infliximab, but also rituximab in adult cohorts seems to be very, very useful. And I have to add that this a drug that can be safely used. This is true. Autoimmune hepatitis is a chronic autoimmune disorder of the liver, so we have to we have to continue follow up for life-lasting. However, a life-lasting follow-up doesn't mean life-lasting treatment. Treatment can be successfully discontinued in the real percentage of patients in which this treatment can be discontinued. It remains unknown, but more or less 10 to up to 40% of patients after at least 2 years of complete biochemical response, the therapy can be discontinued. Which data we have about the predictors of good response after therapy discontinuations in patients who have already achieved complete biochemical response? The transaminase levels, the lower the transaminase levels during therapy, the higher percentage of successful at the time of discontinuation. Also, IgG levels, very low. Also, the absence of necroinflammation in liver tissue. However, this last item requires the performance of a liver biopsy. So in clinical practice, normally we don't use it. It is clear that the longer the time the patient is on response, on complete biochemical response, the higher the likelihood of success at the time of therapy discontinuation. What about data on patients' quality of life? It is very clear that patients with autoimmune hepatitis is a chronic liver disease. Patients with this disease have very high percentage of risk of developing depression. It has been found to be 5 times more frequent than with patients from general population. Also, the risk of developing severe symptoms of anxiety are also higher among patients with autoimmune hepatitis. And the presence of these both symptoms are mainly because of concern regarding the progression of the disease of patients and their families. And this is very well documented in this study. This is data from surveys of patients with autoimmune hepatitis. And as you can see here, the main priorities, the main concerns of patients with autoimmune hepatitis are the scarceness of therapies in order to slow the disease progression, and also one very important concern is the use of corticosteroids. So the avoidance of corticosteroids will be a very important point in patients with autoimmune hepatitis. In this survey, patients were asked about if they will join a clinical trial in order to improve the care of the disease. And as you can see here, the vast majority of patients would definitely or probably consider the entrance on a clinical trial. Moreover, patients with autoimmune hepatitis are dependent on the response to immunosuppressive therapy, and this also have an impact on quality of life. As you can see here in the picture, the patients that achieve a complete biochemical remission present higher punctuation in the questionnaires of quality of life. So clearly, the achievement of this complete remission is associated with a significant higher percentage of quality of life. But it is also important to stress that this achievement of complete response cannot be based on the use of high doses of prednisolone. Why? Because the use of corticosteroids clearly impact negatively on the quality of life of patients, even when these corticosteroids are needed to achieve the biochemical control of the disease. So in summary, this will be the highlights of my talk. Autoimmune hepatitis is a rare disease of the liver, but clearly its prevalence is increasing. At presentation, approximately 1 of every 3 adults with autoimmune hepatitis present liver cirrhosis, more or less 1 of every 4 patients present with acute hepatitis. So it's very, very important try to achieve an early diagnosis of the disease in order to impact on its prognosis. Happily, we have azathioprine. Azathioprine is a very well-tolerated drug, and it achieved the achievement of complete biochemical response in a very high percentage of patients. In those patients who intolerate azathioprine or present an insufficient response to azathioprine, we have second or even a third line of therapy. And for quality of patients, quality of life of patients, we have to keep in mind as physicians that it's very important try to avoid the use of steroids, even for the achievement of a complete biochemical response. Thank you for your attention.